Hello, beautiful people, and thanks so much for watching us here on Great Day Louisiana. I'm Malik Mingo. As always, I hope you're doing well today. We've got a great show for you all. Look, we're beginning with a health and wellness moment with our partners over at Louisiana Blue. With potential changes to Medicare on the horizon for senior citizens, it's important to know when you need to sign up and what you need to do. In fact, Louisiana Blue recommends those of you who are turning 65 in the coming year to register, especially since it can help you avoid having to pay a tax penalty. Today, healthcare economist Mike Berteau and Tress Faraday, manager of Medicare sales operations for Louisiana Blue, are both here to explain more. Good to see you, Mike and Tress. Welcome to the show.
Thank you for having me.
Of course, Mike, my brother, always good to see you. And look, this is one of the perfect people to talk about Medicare because, Mike, you're in that age group.
I call it the on-ramp to Medicare.
Come on, the on-ramp to Medicare.
Right
and
now,
it's good to know that there is an on-ramp. There is a time period when it comes to enrolling for Medicare. Please explain to everybody what that time period is.
Sure. Well, it's all keyed on your 65th birthday. So for 3 months prior to your birthday, the birthday month, and then 3 months after, you're eligible to enroll in Medicare. There are also some people who have certain illnesses that can enroll earlier than that. But when you're talking about a senior turning 65, those are the months you want to watch out for. Now, if you pick a plan and you think, oh my goodness, am I locked into this thing? The reality is you will have an opportunity at some point to change if it turns out to be a plan you really didn't want.
It's so important. It's also important to note that once on Medicare, there is an annual enrollment period every year from October 15th to December 7th. So if you want to change anything, you can do that.
Yep, that's a no harm, no foul period where whichever plan you like or don't like, you can move into, and it'll be effective on January 1st.
Good to know. So if you want to make changes, you do have time to change if you would like. But look, Tress, let's be honest. In these United States, more and more people are working past the age of 65. People who fall into that category, what do they need to know about signing up for Medicare?
What they want to do, if they want to keep working past 65, a lot of folks are doing that. If you have an employer and you have what's called credible coverage, so you have health care coverage through your employer, you can continue to work. Now your Part A, if you've worked your 10 years, whether you want to enroll in that, that's fine, there'll be no cost, but you can delay your Part B, kind of enrolling in Part B. And what you can do, I'm sure there's people at your company that maybe they've been working past 65, you can go to your HR department, talk to them, kind of make a plan of what your timing is going to be. But yes, a lot of folks do continue to work past 65, and that's an option.
And at the end of the day, you need to have that conversation with your employer, like Tress said, and it's better to do it now than right when you're turning 65 or right after. And you know, Mike, as you all can see on the screen right now, there are so many different words when it comes to Medicare. I see the commercials all the time. Enrolling A, B, C, D. You all are seeing what those 4 main parts are. Let's dissect that a little bit more.
Absolutely. Medicare is originally passed back in the 1960s.
Okay.
Today is 3 insurance plans. So you essentially have Part A, which is hospital coverage, and then you have Part B, which covers doctor visits and surgeries and outpatient procedures, and then you also have Part D you can enroll in, which will cover your prescription drugs. Now we've been, lately, over the last 5 to 10 years, we've seen a huge rise in what are called Part C plans. You may hear people call them Medicare Advantage. And what that does is convenient. It rolls A, B, and D into one plan.
Okay.
And that makes it much easier to get that done. And those are the plans that if you hate it in a year, if you have to change, you've got that open enrollment period so you can move around.
When you first sign up for Medicare, which ones are automatically considered? Is it A and B, or is it just A?
If you turn 65 and you're not working anymore, you have access to all of it. So you can enroll in A and in B and in D, or a Medicare Advantage plan in lieu of all 3.
Pick C. It sounds like that's the one that you want to do. You get them all enrolled into one. Once again, you all are seeing all the 4 main parts of Medicare coverage. But let's be honest, Tress, you do this every single day. It can be confusing, okay, when trying to figure out for everybody's certain situation what type of Medicare works best for them. Luckily, there's an agent option that is available, and it's no cost to work with an agent.
Correct.
Tell me a little bit more about how you all can help on that front.
So yes, you would definitely want to connect with a licensed licensed agent, and it's licensed through the state of Louisiana, and they get an annual Medicare certification. So they are certified to give you counsel on Medicare. Now, you know, you can talk to friends and family. There's plans they're on. They like them, they don't, but your unique situation. What doctors do you want to visit? What prescription drugs do you want covered? So you want to go in with some information for them to help guide you to the right coverage, because what you want to do is get the care you need. You want to like the plan you're on and kind of stick there. So definitely there's no cost or obligation to talk to a licensed agent.
Come on, if you all want to talk to a licensed agent, we have the phone number for you, 1-800-568-1417. There's also a website. You're seeing it on your screen right now. But you know, just like regular health care, okay, when you're not 65, it is important to know about the 3 Ps. We talk about this all the time, Mike. It's something that you always remind us of, and I love it because it's important. Tell us a little bit more about the 3 Ps, and moreover, the 4th P that people need to know about if they're enrolling in Medicare.
Absolutely. When you're ready to make this decision, you want to gather up some data. You want to have a good list of the docs and the hospitals you absolutely want to use. Because the first P is provider. The second P, you want to have a list of all of your prescription drugs, because pharmacy is very important. And you should be able to find out in advance exactly what the copays are going to be for your drugs, depending on which plan you join, right? And then we have something called plan benefits. When you join an MA plan, a Part C plan, they'll have extras to help you afford maybe hearing aids or glasses or other things that are not always covered in your normal health coverage.
Ooh, we getting up there in age if we need all that, huh?
Yeah, and then the 4th P, of course, Tressa's talking about is using that professional, that agent who's already done this 1,000 times and knows exactly what you're up against.
It is so important. I'm so glad you all are coming on the show today to talk about this conversation. Whether you're turning 65, going to be 65, or you know someone who's going to turn 65, it's important that they know this information so that they get the right plan that best serves them. Now look, y'all are nowhere near 65, okay? Well, Mike is. He's on that on-ramp, remember? Good luck to you. I think you're going to be just fine. It's so nice to meet you as
Nice
well,
to
my
meet you.
darling.
Thank you.
And look, everybody, there is no cost. Remember to speak to a Louisiana Blue agent about Medicare options. If you have any more questions, call 1-800-568-1417 or head over to their website, lablue.com. All right, shout out to all of our senior citizens out there. We love you. Now look, we're just getting started on the show today, beautiful people. Who's ready to take home a new furry friend? I am. Well, guess what? We have an adoptable one hanging out in our El Simsey Health Wellness Lounge right now. Her name is Sydney, and you can find out more about her at the North Shore Humane Society. Stay tuned for a conversation. Plus, we want to remind you all that the New Orleans Museum of Art is hosting its 2nd Salon Supper Club this Thursday at the museum. The theme this time is a taste of West Africa and New Orleans. It's going to be explored through food, and our guests can enjoy a signature dish from the Carnola and, of course, view some beautiful art. Again, that's coming up this Thursday, July 17th from 6 until 9. For tickets, log on to noma.org. All right, coming up, guess what? There's even more. We have some music for you on this Wednesday. It's Zydeco artist Sean Arduin. Look at my boy. He is ready to perform for us. Stick with us. You're watching Great Day Louisiana. Yes, Sean!